Hello, I'm Angela Serig, and I'm an occupational therapist here at Faulkner Hospital in the Rehabilitation Services Department. Myself and several physical therapists here sometimes treat women after breast surgery when they have trouble regaining their range of motion or strength following the surgery. We're thrilled that this DVD is being given to the patients prior to surgery so they're aware of early, safe range of motion exercises and activity guidelines to help prevent some of the limitations and restrictions that we see weeks later after surgery. In this portion of the video, I'm going to discuss the immediate activity guidelines and range of motion exercises following surgery. I'll also mention lymphedema, describe what it is, the signs and symptoms, and ways to reduce your risk of developing lymphedema. And I will provide you with contact information for guided exercise programs if you have trouble regaining your range of motion or strength following surgery. Immediately after surgery, it's important to pace yourself. Please consider taking the pain medication as prescribed for the first several days to allow for greater comfort when performing the range of motion exercises, more comfort when you're using your affected arm for daily activities, and also to be more comfortable when sleeping. Immediately after surgery, try to use the affected arm for light activities such as brushing your teeth, brushing your hair, reaching for a glass of water, or preparing a light meal as you normally would. However, try to avoid lifting anything heavier than about a gallon of milk for the first 4 weeks if you've had a mastectomy or a tissue expander reconstruction. And try to avoid lifting anything heavier than a gallon of milk for about 6 weeks if you've had a tram flap or a lat flap reconstruction. However, if you have a special situation at home where you might need to lift a little bit sooner, for example, if you're caring for a small child at home, then please discuss that with your surgeon, and they may feel comfortable lifting those restrictions sooner. Walking is a great exercise to begin immediately following surgery, whether it's just for a few minutes, 2 or 3 times a day. Walking can help counter the fatigue and nausea associated with surgery, and it can also help to increase your energy levels. Here are some of the range of motion exercises that you can begin performing 1 to 2 days after surgery. Try to start performing each one about 5 to 10 times, 2 or 3 times a day, depending on how much pain you're in. If you've had a mastectomy, there are no restrictions on how high you can reach or how far you can reach, even while the drains are in. So just perform the exercises until you feel a stretch, but yet comfortable. If you've had breast reconstruction, it's important that you avoid lifting the arms above shoulder height until the drains have been removed, which is usually 2 to 3 weeks after surgery. The first exercise is called shoulder rolls. Starting with your arms hanging at your side, lift the shoulders up towards your ears and then roll your shoulders back and down. Try gently squeezing your shoulder blades together as you roll your shoulders back, so you feel a stretch across your chest. This is a great exercise to begin with as a warm-up because the motion is small. The second exercise is called arm saws. In this exercise, begin with your elbows bent at 90 degrees next to your body. Reach backwards, squeezing your shoulder blades together until a stretch is felt, and hold for about 3 seconds. Then reach forward as far as you can comfortably, and repeat again, squeezing your shoulder blades together and holding for 3 seconds. The next exercise is called the shoulder walk-up. You'll need to go and face a wall and gradually walk your fingertips up the wall until you feel a stretch in your shoulder, like this. You can also turn to the side and walk your fingertips up the wall to feel a slightly different stretch. If you've had breast reconstruction surgery, avoid reaching beyond shoulder height until the drains have been removed. The fourth exercise is called scapular retraction and shoulder external rotation. In this exercise, begin with your elbows bent at 90 degrees next to your body, and then reach back, squeezing your shoulder blades together, and rotate your arms away from your body as far as you can comfortably, holding for 3 seconds. And then repeat. There are 2 more exercises. The next one is called the back stretch. Take your affected arm and reach behind your back till you get to midline, and then try to slide your arm up towards your shoulder blades as far as you can. If this motion is difficult, use your other arm to assist in the motion. Try to hold the stretch for about 3 seconds, and then repeat. The last exercise is called the butterfly exercise. In this exercise, you bring your fingers behind your head, lacing them together, elbows facing forward. Then gently bring your elbows apart until you feel a stretch, and hold for 3 seconds. And then repeat. If you've had breast reconstruction surgery, be sure to keep your elbows below shoulder height and bringing your arms out gently until you feel a stretch, at least until the drains have been removed. Try performing these exercises 2 or 3 times a day, depending on your pain levels, and expect that it might take 2 or 3 weeks to regain full range of motion in your arms. Lymphedema is the accumulation of fluid that can cause swelling in your arm and hand. Lymphatic fluid is normally filtered through lymph nodes in the arm and shoulder area. If you've had an axillary lymph node dissection or radiation to the axillary region, you're at a slight risk of developing lymphedema in the arm. We do not know why some patients develop lymphedema and others do not, but we do know that there are some risk reduction strategies that can help prevent lymphedema from occurring. A full list of risk reduction strategies can be found in your guide to breast surgery. I'll list a few of the most important ones here. Try to avoid getting injections, blood pressure taken, or blood draws from the affected arm if possible. Also, wash and thoroughly cleanse any scrapes or abrasions on the arm to prevent infection. We now know that participation in a light progressive strengthening program once or twice a week can actually help reduce your risk of developing lymphedema by dilating or widening the lymphatic channels remaining in the arm and shoulder. And finally, try to maintain a healthy weight. We know that patients who are overweight are at a higher risk of developing lymphedema. If you notice any swelling in your hand or arm, whether it's weeks, months, or years after surgery, please contact your physician to be referred for care. There are physical and occupational therapists who specialize in treating lymphedema who can help you manage the symptoms. Here at Faulkner Hospital, we have several therapists who are trained to treat lymphedema, or we can refer you to a location closer to home. After surgery, you'll be on your way to recovery. If you have trouble regaining your range of motion or strength following surgery, there are several places you can turn for more guided, supervised instruction. You can get a prescription from your physician to receive some physical therapy. The Faulkner Hospital Rehabilitation Services Department contact information is listed here. Or you can contact the YMCA, which has developed a program specifically for women who've had breast cancer surgery. The PINK program is a 12-week program with classes twice a week. It includes stretching, strengthening, and cardiac exercise. The program is free and you don't have to be a member. Contact information is listed here. If you call the YMCA, they can let you know where the classes are taking place close to your home. Finally, if you're a patient of Dana-Farber, you can receive free membership to the Fit Corps in Longwood Medical Center, and they run an exercise program twice a week for women who've had breast cancer surgery, and the contact information is also listed here. Once you are home recovering from surgery, please refer back to the Guide for Breast Surgery handout, which includes a lot of the information you're hearing today. If you have any specific questions about this section, feel free to contact me in the Rehabilitation Services Department. Thank you.